Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here, and today we're talking about functional medicine and our bones. And a lot of people have heard about functional medicine, but don't really understand this approach and how it's different. Our guest today is Dr. Stephanie Gray, a functional medicine practitioner, and she clarifies this for all of us during today's talk. Dr. Gray is a nurse practitioner, and she's completed her doctorate on estrogen. Her expertise lies with integrative, anti-aging, and functional medicine, and she's the author of Your Longevity Blueprint. And Dr. Gray sees many patients with osteoporosis, osteopenia in her integrative health and hormone clinic. And today, she's going to share the treatment she uses to help people optimize their bone health. But stay around because near the end of the talk, she gives us tips on ways to boost hormones naturally. So stay tuned for all this great information. Welcome, Dr. Gray. I am so excited to have you here and share your expertise with all of us. So thank you so much for coming.
Well, thank you for having me on.
And for those of you watching and listening, Dr. Gray is almost ready to have a baby. So we're lucky that, how many weeks is it now?
I'm about 37. I have about 3 weeks to go.
Yeah. So we're so glad that we got you before you get extremely busy. So very exciting. I think let's just dive right in. You know, you've done so much amazing things, and you've written something called the Longevity Blueprint, and you practice functional medicine. So let's start with, you know, since we're talking about the bones and osteoporosis and bone health, why don't you tell me how, if someone sees you as a functional medicine practitioner and you work with, you know, anti-aging and integrative medicine, how is that different than if they just went to their internist or a conventional medicine practitioner? Like, what different things do you add when someone comes to see you?
Sure. So I think the major difference is our approach. And so many times we describe conventional medicine, which is very much needed, as being more the fire department, right? They're here to put out big, bad, ugly fires. But their two tools are drugs and surgery. That's what they have to offer, right? If you have reflux, they may give you a medication to help quench the reflux. If you have to have your gallbladder removed or need surgery, right? They can provide that. We have excellent fire department or excellent conventional medicine here in the United States. Our approach is a little different though. So we try to get to the root cause of the problem. So beyond those two tools, again, that are needed, the drugs and surgery, we try to get to the root cause of the problem. So our approach may involve different testing, maybe looking for nutritional deficiencies, maybe looking at food sensitivities, hormone imbalances, which we can talk about today. So we just approach things a little differently. We want to try to repair and rebuild the body and fix it so that the patient doesn't have future fires. We also practice integrative medicine. So I want to define that too, because integrative medicine combines or integrates the functional medicine with conventional medicine. And I think that provides patients with the best of all worlds combined, you know, using all of those approaches.
I love that, because what I find is it's so important. We must get to the root cause. And especially with osteoporosis, you know, by just covering it up and not really finding out what's causing the bone loss, we're really, you know, at the end, not helping people as much as we can. So I love that. I think that, you know, is really a wonderful way to look at things. And are you, in your life, has functional medicine been helpful for you?
Absolutely. So I can kind of go into my personal story and how I came about writing the book. I was raised in the Midwest, still live in snowy Iowa here today. What I consider to be a very healthy family. We ate clean, home-cooked meals. We were always engaged in physical activity. We saw the chiropractor. We took our vitamins. So I thought I was really the epitome of health. And I was fairly healthy, but I had a rude awakening in my early 30s. Sitting at my desk, my heart rate took off very fast. So I had beyond palpitations. I had tachycardia, and it landed me in the emergency room. And of course, conventional medicines approach was for me to take a medication to control my heart rate. And that was one option. And that's an option that many people do take. And I was pretty desperate. I almost took it because I wasn't sleeping well. I was dizzy, exhausted, and short of breath. But I felt like I wanted to get to the root cause of the problem. I wanted to figure out why the heck my heart was racing, right? And so I decided as a functional medicine practitioner, if this is how I approach my patients' ailments, I need to approach my own ailments this way, try to figure out what's happening. And about the same time, my husband, who's our office manager at my practice, he felt like we offered so much at our clinic, but functional medicine can be overwhelming, especially to people who've never heard of it before. He felt like we needed to clarify our message really and lay out all of what we can do for patients. And so as I was really laying that out, creating the blueprint, I applied it to myself. And I very much needed conventional medicine. There were a lot of things I needed to do, or I needed functional medicine. There were a lot of things I needed to do to lessen what was happening with my heart. And number one was reducing stress. I was very stressed. I needed to minimize that. There were several nutrients like magnesium, which we'll probably get to later in this podcast, that I needed to take. I needed to change my diet drastically. I needed to go gluten-free. I actually had so much kind of gas and air trapped in my GI system that was putting pressure on my heart. And I would have more of a racing heart until I would actually burp and expel some of the air.
Wow.
So I had a lot of things influencing why my heart was racing. But I absolutely utilized functional medicine, and thank God I didn't have to succumb to using medication to control my heart rate. I was able to get things under control, lessen my workload, practice deep breathing, take my supplements. I had a rude awakening, but through that, I was able to empathize with a lot of my patients who are desperate at times and create the blueprint.
Oh, that's so great, because all those things that you talked about are so powerful. I know in my practice, people come in and they're really stressed out. Oh my goodness, my bones, what exercises can I do? What food can I eat? But the stress is really a huge aspect, and it reduces the bone building cells. So that in itself is something that I think everybody needs to realize how important that is. Have you seen in your practice that when you
Yes.
give people, practices to reduce stress, that makes a big difference?
Everything gets better. Yeah. So stress is our body's biggest hormone hijacker. So if stress is going to rob us of hormones, relevant to today's podcast, that's going to impact our bone density. Stress robs us of nutrients, things like magnesium that I needed for my heart rate. So we don't always realize the impact long-term of what stress has on our health. But yes, since I went through this stressful time, it made me more heavily emphasize the importance of stress reduction with my patients. And I do see it make a significant difference.
And what did you do? What were your practices that worked for you to reduce your stress?
So I definitely had too much on my plate. I think I was just cranking the wheel too hard for too long. I started my practice and went to grad school 3 times. And, I was just doing too much. So I needed to really lessen my workload and create some margin. My husband loves that word. He thinks,
you know what? It's really a good word, because who has margin? I love it as well. Who has margin in their life? We just work to the deadline, and it's not something that we even think about creating. So I happen to like it as well.
And I wish I would have been taught that, in my teens and 20s, how important that margin is. So I needed to create some of that space, but deep breathing has been really important for me. So deep breathing, even over lunch, I'll put a sticky note on my door and just sit in my office and, try to deep breathe. That will calm the central nervous system. So if you're in that fight or flight mode, if you feel stressed out, anxious, even can't sleep at night, incorporating deep breathing can be really beneficial. So that was something that I did incorporate. I do yoga now. I used to do a lot of cardio, and cardio is important. But when your cortisol is already high, when your adrenaline's already rushing, the last thing you need is, more of an intense cardio.
You know what? Let's stop for that, because that's something I love that, because people who get have osteoporosis, they're told to exercise, and so they get on the treadmill and they're working so hard, and cortisol, which is the body's stress hormone, which has negative effect on bone, can reduce bone building cells. So continue what you're saying. So I just think it's important what you just said, because people don't realize, they think more is better. Let me just crank it up. Let me just work as hard as I can. So I think what you're saying is very important, because more is not always better. And it sounds like in your case, it wasn't.
Yeah, more is worse. And so for some patients, more can have a detrimental impact on their bone density. So what I needed more of was to reduce my cortisol, was more calming yoga, which incorporates deep breathing. And when I started, I couldn't sit still. I was just, I don't like this yoga thing, but now I love it and it almost puts me to sleep. So I needed that in my life. And I do take several supplements. I still have stress. It's not that stress is just gone. I just know how to manage it better now. I use a lot of amino acids in my practice. I use L-theanine, which is a calming amino acid from green tea. I'll use that days that I feel a little stressed, feel like I have too much going on. So I do utilize that. I utilize a lot of magnesium. And then another stressor on my body was the foods that I was consuming. So I had to change my diet drastically. So that's the short of it. But.
Yeah, no, that's wonderful, because all those things, people don't realize how much of a difference, it seems like little things, a couple amino acids, a couple supplements, and the deep breathing, but it's huge. It's so impactful and completely life-changing, like you mentioned. So that's great.
Even when we think of back to bone density, if you're eating foods that are a stress on the body, causing inflammation, that will compromise absorption of nutrients needed for bone density as well. So, even those diet changes, some patients think, oh, that's going to have minimal impact on my health, but it can have a substantial impact.
It's really amazing, food first. I love that, because people, I guess the way that, our society is, the impact of food hasn't really been emphasized nearly as much as I think it should, because I see it every single day, how completely you can change your life and you can change your health, and by, all sorts of things, but always with food. So yeah, why don't we just dig right into the deficiencies that you see with that? And because in your book you have a great chapter where you really go over, which I liked about your book is that you really did address osteoporosis in the bones, because a lot of times we think of that as just something else. It's not the most important thing, but it's very, as we know, it's very important. And so why don't we go right there about what you've seen in your practice and what you feel are the most important nutrient deficiencies that we need to, nutrients we need to have in order to have strong, healthy bones.
Sure. So typically calcium is the first nutrient that pops into patients' brains when they hit menopause, the age where they're told, okay, bone density can start declining. And unfortunately, I think our population is overcalcified.
I see that. I would say probably 80% of the people I see are taking too much calcium. Exactly.
And, I personally have had a kidney stone, which was the worst pain of my life. Granted, I haven't gone through labor yet, but I will. And the kidney stone was not fun to have. And, I had been taking vitamin D, not calcium, but I had been taking lots of vitamin D because my level had been low. And so that really also, through personal experience, it more alerts me on the importance of taking other nutrients, like even K2, which we can get to. But back to calcium. Calcium can be detrimental. So if it doesn't get absorbed into the bones, it can form things like kidney stones or calcifications, clogging the arteries. And heart disease is extremely prevalent, right? One of the top killers these days. So I do not recommend patients take a lot of calcium. I always look at the form of the nutrients that my patients are taking to make sure they're taking a highly absorbed and very high quality nutrient. I don't like tablets. Tablets tend to sit and stew. They don't always get absorbed very well, so capsules or powders are usually better. But I'm not big on calcium from a supplementation standpoint. Many patients are getting enough in their diet if they're eating leafy greens, which I obviously recommend to my patients. So above and beyond calcium, I tell patients that your bones need more than calcium.
I so agree with you, because typically what I see, that they're on calcium and vitamin D, and really those are really only the two that most people, the majority of people who have osteoporosis or they're trying to prevent it, are taking calcium and too much calcium, as you said, and vitamin D. So let's enlighten everyone to all the other things that are just so important.
So I will say the best way to know how much vitamin D you need is also to have your level tested. So
yes.
Absolutely have your provider test your level, because then you will know if you do need to take it. Maybe you're getting some in your diet.
And that's an easy test, the 25 hydroxy, just a simple test that's, should be with most blood panels. Yeah.
some patients, despite taking vitamin D, which does help with calcium absorption and phosphorus, still can't get their level up. And so those patients many times need magnesium to help, and K2 to help with the absorption. There have been several studies showing that many osteoporotic women are actually lower on magnesium versus calcium. So what they need more than calcium is magnesium, and magnesium comes in many foods, but many of my patients, I mean, let's face it, if you have osteoporosis, you're probably going to need more than you're going to be able to get from diet. So I do have patients supplement with magnesium, and there are various forms available of that. I like magnesium glycinate. I'm okay with other versions, but you don't want to take like a cheap magnesium oxide. That's great for constipation, diarrhea, but it's not going to positively impact your bones. You want to make sure you're taking like magnesium glycinate or an amino acid chelated version of that mineral. So to describe what that is, the mineral, like magnesium, should be bound to or chelated or piggybacked upon an amino acid, because your gut loves amino acids, so it'll help that magnesium get absorbed into the gut better. So that's typically the form of magnesium that I'm recommending to patients. So magnesium is great for bones, is great for all kinds of other things, even like with my story, calming my heart, helping me sleep, helping with anxiety, calming the cortisol, right? So magnesium is very important. And then vitamin K, K2 specifically, is also very important. You want me to talk a little bit about that one?
Yes, please do, because K2, for some reason, you know, magnesium, most people agree, and most conventional doctors agree to magnesium, but for some reason, even though the research is out there and it's so important, I think K2, people know about it, but it certainly hasn't gotten the press that it should, as important as it is. And I think it's absolute. I think, as you said, magnesium and K2 are non-negotiables. They're critical when it talks, when you're thinking of increasing, you know, of addressing your bones and really, you know, really trying to give your bones optimal nutrients so they can be as strong and healthy as they possibly can. So absolutely talk about K2, because I think it's, and I have everybody on that as well. I think it's very important.
So typically in my practice, if a patient does have osteoporosis or osteopenia, or if they just want to optimize their health, we'll do a comprehensive nutritional evaluation where we can look at all the levels of nutrients to see what they really need. Unfortunately, one of the nutrients that we can't really test for is K2, but we can assume that many of patients like me who, you know, had a kidney stone or who have calcifications or who have osteoporosis, they probably are lacking vitamin K2. Several studies have shown that K2 is directly linked to bone mineral density. So K2 helps bind calcium into the correct place, into the bone. So again, it doesn't cause heart disease. It doesn't clog the arteries, whatnot.
Yeah, I think that's so important, that K2 does, you know, two things. Besides getting it into the bone, it also sweeps the calcium out. You know, it takes the extra calcium so it doesn't go where we don't want it, like the joints, the kidneys, and the, you know, and the arteries. I mean, so I think, you know, having calcium without the K2 and the magnesium, it's a real problem.
The analogy in my book that I use is that vitamin D is the doorman. So vitamin D opens the door for calcium to enter the bloodstream. But once it's in the bloodstream, vitamin D has no control over where that calcium is going to go. So K2 is more like the usher that then directs the calcium into the bone matrix. So you want to have all on board. And I think maybe some of the, I don't know, controversy or challenges with recommending K2 comes from the fact that many individuals think we should be getting it in our diet, but we don't. I really think we're lacking the K2 in our diet, primarily because of even the foods that we're eating. Like if we think of cows aren't always fed grass, you know, anymore. Sometimes they're fed grain. And if our foods aren't consuming K2, then we're not getting, or the vitamin K, then we're not getting the vitamin K either.
That's true. And there's the one thing, I do have a few people that I work with who I can't do it. I can't seem to eat it. The natto, the Japanese natto, which has amazing amounts of K2, but it's just so slimy and gooey that I don't know if you found people have been able to eat that.
I've never tried it, but I actually want to, because I read about it. But you can get K2 from other, we'll just say kind of fatty foods. Not that I'm recommending a lot of dairy to patients, but egg yolk, butter, liver, you can get K2 from some other foods. And you also want to have a very healthy gut environment, because the bacteria in our gut is very important for K2 conversion and production. So again, back to eliminating food sensitivities, reducing inflammation in the gut. Believe it or not, that'll help with K2 as well. With vitamin. Yeah.
Great. No, that's great. That's so important. These I can't even stress how important these are. And the so you know what? Why don't you tell everyone, because you wrote the longevity blueprint. So what does that actually mean in terms of, I mean, why don't you fill us in on the meaning of that? Because I think it's very powerful.
So throughout the book, I'm trying to compare how we know how to maintain our homes, right? We keep hair out of the drains, we change our furnace filters, we mow our lawn. There are just so many things we do to maintain our home. But we don't always know how to maintain our body. we know we should exercise, we should try to get sleep, whatnot, and reduce stress. But I think patients, and even myself, really needed an outline as far as what we can do with each organ system to really maintain it. So again, I'm comparing how we maintain our home to our body. So chapter 1, I'm comparing the foundation of the home and how strong that foundation needs to be to support the weight of the entire home, that structure. I'm comparing that to the gastrointestinal system, because I think if we had to have a foundation of health, it would be our gut. And then I go on through each chapter and I'm comparing a part of the house to a various organ system within the body. So for instance, chapter 6 is all about the heating and cooling system of the home, comparing that to our endocrine system in the body, or optimizing our hormones. So I'm trying to make that comparison. And then my goal within the book is that the reader or the patient or practitioner, whoever's reading the book, won't just address one room in their home or one organ system in the body, but if they want to really build a longevity blueprint, if they want to live a long, healthy life, they'll address every single chapter, every single house in the home or organ system in the body.
That's so great, because people come in for their bones, but the bones are connected. It's part of the body. So when one system fails, I sort of look at it, I tell people they're upset, but I sort of think, you know what? It's actually, there's good news here, because you're getting an indication that maybe something isn't working properly, and you have the ability to reset, to sort of look at everything, see what root causes can be, and in the end, you're going to be a lot healthier. But I love what you said with the foundation and the gut, because a lot of people don't realize the relationship to the bones. And if there's issues with your gut, you're not going to be absorbing the nutrients. So do you want to go into that in a little more detail? Because I love how you describe it in your book.
Sure. So I'll also say, which I guess I left out, because the audience may say, well, that sounds really good, but what's the method to the madness? Within each chapter, I go through, so like within chapter 1, I go through the various functional medicine testing options that exist to optimize that system in the body. So with chapter 1, in order to improve gut health for patients, there are 2 things we need to focus on. So one is removing food sensitivities, and then secondarily is reducing gut infections. A lot of patients have H. pylori, or they've had parasites or yeast overgrowth or small intestinal bacterial overgrowth, just various conditions that they didn't realize could be, again, part of the root cause of their health dilemma. So we test for those. And then in each chapter, I talk about the testing options that are available for that organ system and various supplements that are also available. So I think for many patients, unfortunately, because so many of our foods are genetically modified and a lot of herbicides and pesticides are now used on the foods, these foods our immune system doesn't like. So our body's really rejecting them, creating antibodies to them. I think the majority of autoimmune diseases start in our gut. So really identifying and eliminating the inflammatory foods for each patient is important. For some, that could be gluten. Others could be soy or corn or yeast or dairy or eggs, sugar, whatnot. But we try to personalize that with each patient to know which foods they need to remove. And then we check in with them and see if they're obviously feeling better after removal of the food.
That's so important, because I've seen several patients now who did not have celiac disease, but had gluten sensitivity, non-celiac gluten sensitivity. And once they got off gluten, their bone density increased. And some of them, there's one in particular who was on Fosamax, didn't help. And she needed to once she got off gluten, all of a sudden her bone density really increase. And what typically people are tested for celiac only. And because that is, people do consider celiac a reason for, for osteoporosis and low bone density. So that's something now in conventional medicine that really is looked at. However, if you don't have celiac, which the majority of people don't, that's only, a very small percentage of the population, the gluten sensitivity is huge. And it really affects bone density. And I think I've been surprised, not surprised, but I can't get over when I see people 2 years later, they have their bone density and it's so improved. And one of the big factors was gluten. So I think it's very important what you're saying is testing for these things. And then people can eliminate them and have major improvements in their bones, but also, I'm sure, in their entire lives. So that's great.
I totally want to echo that, because even with my own case, my blood work for celiac was positive, and I had known that I had a gluten sensitivity. When I had my biopsy to get the full-blown diagnosis of, celiac disease, my biopsy was negative. So that was good. That means the little microvilli in my gut hadn't worn down to stubs.
Exactly.
Yet, but I was on my way there. So I needed to change my diet. And clearly, like you're mentioning, even patients with any degree of sensitivity, they don't have to have full-blown autoimmune disease to have challenges. If they have any sort of sensitivity, it still can be impacting their health. And so it's important to raise awareness and not underestimate how helpful it can be to still eliminate those offending foods, before you have raging celiac disease.
I think for everybody listening, this is not really I guess I'll just tell a 2-minute really quick story. My husband, who's a physician, was very, very, very sick. Nobody could figure out what was wrong with him. I mean, he was sweating through 3 shirts in the evening. He was still working, but he was coughing nonstop, and he was losing weight, and he went to so many doctors and nobody could figure it out. And finally, when all hope was lost, he decided, I said, look, I'll help you if you want to try a different method. But anyway, sure, we had him tested and he had antibodies to gluten. And once we removed the gluten and started doing, and started building him up with supplements and some energy work, he's fine. But the gluten, I think, was the main was really the problem. That once the body, I think he had so many antibiotics because they thought, and that once he had what's called the leaky gut, or there was openings, the gluten comes in, the body thinks it's the virus, and it starts attacking. So I lived with that, and I think that was interesting because he's an OB/GYN, and he couldn't get over. So when he can't figure out what to do with one of his patients now, he'll, get them off gluten. He's been telling me he can't even get over what he's seeing. And I'm sure you see the same thing once people get rid of some of the offending, foods. And once the people, so it's a very, very important point. And I think that, I think that's great that you test for everything as part of your whole program. That's wonderful.
Well, I don't know. I'll go off on a little tangent here. I don't know if he sees many patients with infertility, but I had severe endometriosis as well. And so we had a very long fertility journal, which will be the topic of my next book. But really eliminating not just gluten, but also dairy. And I did several things along my fertility journey, but I was able to get pregnant. Right? Here I am pregnant. So eliminating foods impacts several organ systems, and there is significant research showing removing dairy can really help with gynecologic issues like endometriosis. So if you're out there listening, searching for answers, even if it's not for osteoporosis, removing certain foods could be the root cause of the evil there, could be the answer.
Isn't that amazing how the elimination diet can help? I mean, it's simple. And it's, it might be something that people don't get to for 5 years of suffering. And so I think that, I love your approach where right off the bat, you're testing for these things, and that's part of your program. So, but same thing with osteoporosis. It's not something that people really think about, that it could be, something that's, a big issue with their bones.
Right.
Yeah. So that's great. So why don't we go right into, I guess, hormones, since I know that's something that you deal with a lot in your practice, what you found, and, start from the very basics, what people can do, I guess maybe do the progression when you see that there's some hormonal issues.
Well, so I see women of all ages, and so even women, my age, who have challenges, heavy bleeding or endometriosis, or maybe they're not cycling or whatnot, that alerts me that they may be having some hormone imbalances. And so one of the strengths of functional medicine is that we're going to test for hormone imbalances. Starting at young ages, I wish everyone would get their hormones tested in their 20s, 30s, 40s, 50s, 60s, so we could track their trends and really see what's happening. But if we speak specifically to patients with, osteoporosis, well, I was going to say the majority of the patients I see are menopausal, but I've had women in their 20s and 30s have osteoporosis due to low hormones, due to not cycling, which is really scary. They're too young.
Think about that. Can you imagine? Wow. Because I don't usually see them. I mean, most of the people in my practice are, the youngest usually are in their 40s, but most of the people are, in their 50s and beyond.
Patients may come to me for a functional medicine approach to get them cycling. And I think, if they're not cycling, we better be tested. They likely have low hormones. So we should test them for osteoporosis. And I've found many, unfortunately, have it. The good news is we can work to improve that if we can get their hormones up. But it's really important to note that relationship. So what happens when women hit menopause? Their hormones decline. Same with men, even men who hit andropause, the midline change. Hormone levels decline. I even have men with osteoporosis who we treat with hormones in my practice. And that's really what's happening at that age. Yes, those women need to be taking nutrients, need to be exercising, but many times the hormone decline is what has caused this problem. And so estrogen, progesterone, and testosterone, even in women, have been shown to really improve bone density significantly. So it's one of the strongest interventions that we use here at our practice that has had amazing results.
Interesting. And in terms of prior to that, are there nutrients or other things that you use to try to, what's your base level when you would start with someone before you get to that step?
So I guess it depends on how severe their osteoporosis is. I mean, if it's very severe, we may initiate hormones right away.
Right.
Not all patients want to take hormones, and maybe we should talk about that first.
Sure.
It's around hormone replacement therapy. So many patients and providers have been scared to take hormones because hormones cause cancer. And hormones don't cause cancer. Even the National Cancer Institute will say that hormones don't cause cancer. They can cause the growth of an existing cancer, right? So if you had an estrogen-fed breast cancer, you don't want to take estrogen. But generally speaking, hormones do not cause cancer. Really, cancer, I believe, boils down primarily to the environment. But what we don't want to do is we don't want to necessarily mimic, and from a functional medicine standpoint, what was done in the Women's Health Initiative study. So in that study, synthetic hormones, Premarin specifically, pregnant mare's urine, was used. And women, although their bone density improved, they did have increased risk of heart disease, of cancers, and I want to not replicate that in my practice.
Absolutely.
Want the pros, but not the cons. And so I don't use horse urine. I use more bioidentical natural hormone replacement therapy, which is typically plant-based. And the difference is the molecular structure. And I have this all mapped out in my book also just to show patients. The natural hormones should bind like a key fitting in a keyhole. They should bind to your hormone receptor appropriately and not cause a lot of side effects. They're not difficult for the body to break down or metabolize, or we'll say detox from. The synthetics can cause a lot of side effects. And so that's where we really don't want to use those. Although even the synthetics can improve bone density, they have those other risks. So within my practice, I use natural hormone replacement therapy. And you're kind of asking at what point do we initiate that? Well, it depends on their diagnosis, their symptoms, and then their labs. If we test their estrogen, progesterone, and testosterone and they're all 0, if they're low, we can probably improve their quality of life by going ahead and initiating some hormone replacement therapy. And there are various ways to do that also. If you want me to talk about all those.
Yeah, I guess, that would be great. But I have a question. So early on, if it's not that bad, what types of things do you, like, for example, you talked about stress before. What other things do you use in your practice before you get to that level? Like, what would be the first steps that you might do with someone that can also help their hormones? Let's say people that it's not 0. Maybe they're just starting to have some issues.
Sure. So actually on my website, there's a free PDF on 3 tips to boost your hormones naturally.
Oh, great. And we'll have your website in the show notes, and we'll have all that at the end of the program.
So the number one tip is what you just said, to reduce stress, because Stress will rob you of hormones, and we discussed that a little bit here. Number two, we've also highlighted, which is fixed nutritional deficiencies. I've seen women have menopausal symptoms like hot flashes. Just take a multivitamin, get some good nutrients in them, and their hot flashes go away. Clearly they were so nutritionally starved that they just needed some nutrients. So number two really involves fixing nutritional deficiencies. So back to the supplements that we mentioned, but not just the nutrients for bone density. I mean, I would put them on a more comprehensive regimen also. So a lot of patients will need the magnesium, they'll need zinc, they'll need selenium, they'll need more fat in their diet. Your hormones come from fat, they come from cholesterol. So if you're on a statin medication, or if you're on a very low fat diet, you don't have the building blocks to make hormones. So we really assess what patients—
You know what? Yeah, I'm sorry, continue.
Well, no, go ahead.
No, I just wanted to stop you because that point is so, so important, what you just said. I see so many people, we grew up, fat was the enemy, and with bones, vitamins A, D, E, and K are all fat soluble. So we need that fat, and besides with the hormones. So it's so hard to try to, change people when they've believed that fat is so horrible, and we've been brought up that way. So I think that's really, obviously healthy, good fats, but,
yes.
but I think that's a really important point. So
I'm a big fan of avocados and seeds and nuts and coconut oil. I mean, we want to make sure patients are getting ample fats in their diet so that they can make hormones. And that's one thing I have to change. And even young women who come to me, again, who aren't cycling, half the time they're 90 pounds, they haven't been consuming any healthy fats. We've got to change their diet, incorporate some of those. So again, reducing stress, fixing nutritional deficiencies. And then the third tip on that PDF is to really remove toxins and really help the body detoxify. So what unfortunately I won't go off on too big of a—
No, we could talk for 5 hours. We could do a whole day on toxins, but yes, but definitely touch on it because it's a very, very important topic.
So I think, unfortunately, especially my generation, we've been using or bombarded with so many toxins. I live in Iowa. We're exposed to herbicides and pesticides floating around in the air. I'm surrounded by cornfields. In all the personal care products that I grew up using, they had parabens and phthalates. They had endocrine disrupting chemicals. Those chemicals can bind to our hormone receptors and actually shut off our own internal production of hormones. And so for many of my patients, getting them to eat organic, not use plastic, changing out their personal care products to something that doesn't contain endocrine disrupting chemicals can be very helpful with ultimately assisting their body to produce hormones.
And have you seen, because for the people listening, I believe in that as well, and that's what I preach, but so often I meet resistance. Oh, come on, that can't have such a big impact. So what have you seen in your practice when people do make those changes?
Oh, it can.
I agree.
Whether it's, it's sad and it's frustrating to me that within my generation, we see so much infertility and endometriosis and PCOS and amenorrhea and men with low sperm count and whatnot. I think that's because we've been exposed to so many stinking toxins that's been messing with our endocrine systems. And so have I seen great results with my patients? You bet. I mean, we don't only have them remove toxins, obviously, we do everything else as well, but yes, patients are astounded, and they actually sometimes get upset too that no one has proposed to them that all of these things could be helping get their hormones back in balance. But it's really rewarding when we can. You get a patient cycling, or you help a patient get pregnant or whatnot. It's very rewarding.
And think about it at a young age. Think about how wonderful that is. So when you do that, that change itself is majorly helping their bones. So just by doing that can prevent osteoporosis later on.
Yes.
So I think that's amazing. That's wonderful that you're taking care of people at all ages and starting with the foundation and just, correcting things then so that they don't have problems later on. That's really great.
I love it when I see a mother as a patient, maybe in her 50s, whatnot, and we get her bone density improved, and then she starts thinking, oh, my daughter has really heavy periods, or, my daughter has such and such symptom. I think I should bring her in, and then we're also able to help her. I love it how, we're able to kind of change that, create that paradigm shift in that mother's mind, and now she's applying those functional medicine concepts to other members of her family, thinking, oh, I bet functional medicine could also help them. And I love that when we,
You know, I love that too. And I really hope in my heart that that translates to the world, that when people see that these simple root causes, and if we can deal with the toxins and just all the things that you talk about in your blueprint, it can really make a huge, we spend such a fortune on healthcare, but yet there's simple interventions that can be, that could save our country. Think about how much money, my gosh, we could save if people implemented some of these simple tweaks.
We're talking about osteoporosis, but you bet this all applies to diabetes and heart disease, stroke, autoimmune disease, cancer. You know, all of these functional medicine principles apply to other disease states as well.
Yeah, I think that's really wonderful. And did you want to just expand on what the options are? So we talked about the basics, and then when you do treat them with the hormones, what type of options do they have?
So obviously we only recommend the natural hormones to our patients because we believe strongly that they're the safest option available. But some of my patients are very sensitive. And for those patients, we want to start on a lower dosage, a more conservative approach. Maybe we'll use a topical gel or a cream for those patients that can be applied to the lower half of the body. I hate it when patients come in and they're applying creams, you know, an estrogen cream or something to the upper half of the body, because that could get pulled into the upper lymphatic chain and get carried to the breast. So lower half of the body only if we're using topical hormones. But topicals are pretty weak. And so if we need to have a more significant impact on bone density, then many times I'll be recommending something stronger. So there are some hormones that are available as an oral option, like a capsule. Progesterone is safe when given orally. I don't usually give estrogen orally just because, again, that was used in the Women's Health Initiative study. And many times the oral estradiol that's given will convert to estrone. I saw 2 patients this week, both of who were taking oral estradiol. Their estradiol levels had never been checked. I did check them and they were both normal, but their estrone levels were in the 400s and 500s.
You want to tell everyone, because everyone doesn't know the difference between estradiol and estrone. So maybe explain the difference.
So we all have at least three different estrogens: estrone, like E1, estradiol, like a duo, E2, and estriol, which is known as E3. Estradiol is typically what's given these days. What was used in the Women's Health Initiative trial was more of the conjugated estrone. It was more E1, but we think estrone is most dangerous because of how it gets eliminated by the body. And so you really don't want to have high levels of estrone. Estradiol's more important, and it has a more significant impact on bone density also. And E3 is typically very safe. That's many times only given for vaginal dryness, given in a vaginal form. But with these cases that I saw this week, I was astounded that the estrogen levels were so high. And again, no one would have known because the levels had never been assessed. So an estrogen dominance was created in these patients, not intentionally. Their numbers had just not been checked. Many of these patients needed progesterone. Progesterone's most calming hormone, needs to be balanced when you take estrogen. And so progesterone is safe when given orally. So many times I will, and both of these women were never put on progesterone. So we went ahead and put them on some progesterone, which they needed for several reasons, but progesterone is also important for bone density. So we have topicals, we have orals. Sublingual compounded options like a little lozenge under the tongue can also be used. The sublinguals are kind of like taking B12 under your tongue if you're familiar with taking that. The beauty is that the hormone gets dissolved right into circulation, right under the tongue. So very quick impact can help patients fall asleep as well. And then my favorite way to boost hormones is through pellet therapy. Pellets are almost like little grains of rice that we actually, in a surgical procedure in office, it's very quick, just takes a few minutes. We actually implant in the fatty tissue, kind of on the upper, bottom, lower back, kind of where there's a little fat pad there, and they're released over 3 to 6 months. Although many people haven't heard about pellets, they have been studied since the 1950s. They're the longest studied form of hormone replacement therapy that exists. And the beauty is that the pellets are released based on cardiac output over 3 to 6 months. So rather than every day having to take a pill and your level peak and trough every single day, when you're taking a pill, or even with a patch, patches are another option. I consider those a topical. Levels are going to peak within a couple days and then go back down. That's why the patch has to be changed every 3 days. So on day 1 as compared to day 3, your estrogen levels are going to vary a little bit. With a pellet, You get a very sustained release over those months. And in the literature, pellets have shown the most significant improvement in bone density. So I've been in practice about 10 years, and I've been offering hormone replacement therapy for all of those years, but pellets only probably the last 5 years. And within the last 5 years, I've seen significant impact in bone density. I've seen patients go from osteoporosis to normal bone density. There have been studies showing as great of an increase as 8.3%, which is phenomenal. Many times with medications, we're hoping to just sustain bone density. We hope it doesn't worsen, but to actually be able to build bone density is amazing when we use hormones. And pellet therapy, because it's the most aggressive and the strongest, has a more significant impact on bone density than the latter options that I mentioned.
And how many people in the country are doing that? I mean, how common is the pellet therapy?
So my practice was the first practice in Iowa that was certified. We are certified through BioT. They're the biggest pellet company in the nation, started by OB-GYNs, actually. So down where BioT was started in Texas, there are, thousands and thousands of providers. BioT, I think, has millions of patients in their database now. In areas like Iowa, where we're not as progressive, there are fewer patients. We've pelleted several thousand patients here in Iowa, but I know that BioT's database is growing because the results of the pellets have been so significant, and the safety profile is also wonderful of the pellets.
So great. That's really so very interesting. Well, we could go on and on, but I could talk to you for hours. You have such a wealth of knowledge, and your experience is just really terrific. Is there anything else you want to share with the audience?
This was fun. I think we talked about a lot of different concepts. I would just say, if you're listening and you are frustrated with your health, if you haven't been able to find answers, really consider reading my book. There's a lot of information in there. It's 350 pages. It might seem overwhelming, but you can flip to, what pertinent chapter you want to start with, if it's the one on bone density or hormones, whatnot, because answers exist. But the summary at the end of my book is that you need to find a carpenter or a contractor, what I describe as a functional medicine provider, who can help you personalize a plan to build your health. So don't give up. If you're told your labs are normal, but you don't feel normal, or you're having symptoms, keep searching, because I guarantee there's a provider out there, practicing like how we do, from a functional medicine approach, that could help you.
I love that. I mean, that's especially after my husband was so sick. The motto is dig deeper, because don't let them say, oh, I'm sorry, there's nothing we can do, because there's a lot that can be done, and you just need to look for it. And I think that your longevity blueprint can really help so many of us really find answers, because you offer so many options. And I think it's great that you wrote that, and congratulations to you, because I really believe that that's going to help, that already is helping people all over, because it's so complete, and really, you really did a great job of mapping it out. So,
thank you.
And so I'll have all the, all the links and everything, so that we can get in touch with Dr. Gray and find her website. And also she's offering us a 10% discount, anything that she sells at her store. So we'll have all the links for all of that. And I just can't thank you enough. And I can't wait to hear the good news. You'll have to let me know when the new arrival, when this happens. And good luck. I'm sure you're in good shape, and it's going to be just a wonderful experience for you. And,
thank you.
And anyway, but thank you for taking time out of your day. I know the weather hasn't been that nice in Iowa today. Thank you for taking time out to join me and to share all this knowledge with all our listeners. So thank you so much, Dr. Gray. It's really been fun, and good luck to you. I'm excited to hear.
Thank you. Likewise.
I hope you enjoyed today's talk as much as I have, and have some good takeaways. All of the links that Dr. Gray mentioned are in the show notes. So bye for now, and look forward to seeing you on our next episode. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app, so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.